Hello everyone, welcome to Mental Health and Science with Enock Francis. Today we want to look at how stress causes ulcers or peptic ulcers. So today I am joined with Dr. Bale, who is a medical officer and is here to explain for us what ulcers is and how does stress bring in this component of causing ulcers. Okay? So if you are still new to our channel, we request you to subscribe because we are discussing something which is very important. Thank you so much. So Dr. Bal,
Yes.
welcome to the platform.
Thank you very much.
And we have been talking about mental health issues. And many people have a belief that stress, actually in our medical field, we always tell people that even you have a lot of stress, it will cause you ulcers. So what is ulcers and how does this cause ulcers?
Thank you very much, our viewers. Peptic ulcers is a condition where there are wounds or bruises in the inside lining of the stomach. And usually the upper part of the intestine, what we call the duodenum. So if there are wounds in those areas, they could be just bruises in those areas. That is what we usually describe as ulcers. It is by definition in medicine, peptic is ulcers in the stomach, and then duodenal ulcers in the upper part of the intestine. But many times when these patients come, they just know, and many health workers just tell them that they have ulcers.
Okay, so we have wounds in the duodenum.
We have wounds in the duodenum, or wounds in the stomach, or they could be bruises. That is what we are calling peptic ulcer disease.
So when you talk about the wounds in the what, I'm trying to imagine how do these wounds come in this stomach and all those other things.
90% of the cases are caused by a bacteria. It is called the H. pylori bacteria. Many times when we are testing when we are managing cases of patients with ulcers, we test for that. Because most of the cases, the first culprit that buries those holes inside the stomach is that bacteria. So ulcers is an infection. That is what you need to take note of. But of course, stress plays a very, very key part in its progression, in its worsening, in it becoming complicated.
So it is caused by H. pylori.
It is caused by H.
So
pylori
how
bacteria.
does stress bring in how is stress related to this peptic ulcer? Or how does it, because many people think that stress causes what? Ulcer.
Well, stress, it is wrong for us to say stress directly causes ulcers, but it worsens, many times it worsens the state of ulcers, because stress causes the body to secrete some hormones that we call the cortisol. This hormone here usually causes the stomach to secrete excess acid. As a result of that, the acid is pouring on the bruises, on the ulcer wound, and of course it keeps on eating up and causes more worsening of the symptoms.
It's like someone trying to again crush in the wound.
It is like someone putting an onion or someone applying spirit on a wound area. So it causes that burning sensation. So stress will cause increased secretion of stomach acid, which will cause worsening of the symptoms, but not worsening the symptoms only. It also actually causes the worsening of the disease itself, because it can make the wounds bigger.
So stress makes the wounds bigger.
It can make the ulcer wounds bigger in the stomach, because it causes secretion of excess acid that can eat up the wound and increase the wound sizes in the stomach.
So if you are still new to our channel, doctor is telling us that stress does not directly cause ulcer or peptic ulcers, but it worsens. It makes the body to produce this more of the acid that goes again, widens the wounds in the duodenum or in the stomach, worsening everything.
Yeah.
So, doctor, what are some of the complications of having ulcers?
Ulcers is a killer disease.
Mm.
It is also a dangerous disease because it needs to be treated well.
Mm.
One of the complications of ulcers is the wound taking very long to heal, and someone develops what we call chronic peptic ulcer disease, and that is why the perception outside there that people have in the public is that ulcers actually doesn't heal. It is not true. Ulcers actually heals, but the problem, if it is poorly treated, it has a risk of it becoming a long-term disease that takes very long without healing, with many complications. The other complication that ulcers actually can cause, ulcers can cause can lead to stomach cancers.
Stomach cancer. Okay.
Of course, we are talking about it being prolonged and the wound being in the stomach area for a very long time. Any area which has a wound in the body that doesn't heal for very, very long time risks developing a cancer, because the cells around the wound area can easily change from normal cells to abnormal cancer cells.
So the cells become abnormal.
The cells become abnormal in the nature and actually change to cancer cells. So then someone ends up having stomach cancers. And it is on this note that we are saying, do not say that you have ulcers for a very long time. You need to go for advanced tests. You may need a camera to be entered into the stomach to ascertain the state of the ulcers in your stomach, because many times you're saying you are an ulcer patient when you have actually developed stomach cancer without you knowing. Because some people have been patients of ulcers for 20 years, 25 years, 30 years. Please go for endoscopy, upper GI endoscopy. Come and see the doctors. Let them recommend for you the appropriate tests so that you can have proper diagnosis, because you may be thinking it is still ulcers when it has already changed to cancer. So that is second complication. The third complication is actually internal bleeding. We see this quite commonly, that the person is having low blood level, but they have not been cut. They have not gotten an accident. You know, they are not seeing any form of bleeding. It is some few that can be vomiting blood and seeing blood in their stool, but for many people this bleeding is concealed from inside the stomach and you can't see it, you know. So there can be internal bleeding as a complication of ulcers. Then the fourth and maybe the worst is that wound in the stomach can actually penetrate and open holes in the stomach and upper part of the duodenum, what we call a perforation. And once that happens, it is an emergency which will require a surgical operation to be done to be able to close the hole. But we see it quite often. Those are the complications.
So thank you so much, doctor. Now, lastly is that, you know, there are so many people who can be stressed with various things in life, as you know. And there are those people who like that, for me, I have my stress, I am what? So which kind of advice do you give to such people?
Stress.
All the time, there are people who can even stress themselves. Okay, they want to show other people that we are stressed, we are having issues.
Yeah.
So which advice do you give to them?
Stress is a disease that needs attention. My advice is that do not ignore it. There are health professionals that specifically handle stress. You need to see a mental health expert to give you counseling on how to handle. You also need to see the mental health expert, because you may be given on top of the counseling and psychotherapy sessions, you may actually need medications to come out of your stress. But stress is not good for your health. you need to attend to stress and actually start thinking about it as a medical condition. Do not fear. Talk to doctors about it. Let them help you, because you may delay and you get worsening of other medical conditions, like we are talking about ulcers, but all other medical conditions can actually get worse. Pressure can get worse, diabetes can get worse, heart problems can get worse. All these conditions, if you are dealing with a lot of stress, can get worse. So you need to see the doctors, you need to see the mental health expert and have it attended to. Do not ignore stress.
Thank you so much, Dr. Bale. Yeah. We are based here in Eastern Uganda, in Toro district. So on our platform, we are inviting people to partner with us. We have, about 14 million Ugandans have mental illness, and most of them they don't have access to a mental health profession, and most of them still believe that mental illness is caused by witchcraft. So we want to sensitize the communities on radios, having community dialogues on mental health. So we are inviting people to partner with us to support our mental health programs in our communities here in Tororo and also in Uganda at large, because we want to promote mental health in our communities. We need mental health drugs. We need facilitation for transport to go out for community dialogues, and go and educate people on the radios, even pay the radios require us to pay certain kind of fee. Okay. Then also I have a vision of visiting Nachiva Refugee Settlement, where I was working for 2 years and 5 months with Medical Teams International. But since the US stopped funding most of the organizations in Nachiva Refugee Settlement, these people are suffering silently. So I would wish to be visiting them every month, to go and offer mental health services, to go and carry out community dialogues. And these people also need drugs. So we are looking for, if you are an individual, you are an organization, okay, you are a well-wisher who wants to promote mental health in our communities, you are most welcome. Our contacts are just there. Please get in touch. And mental health is a fundamental human right. Everyone can have mental illness. Okay? So if you are still new to our channel, we request you to subscribe and continue sharing this information, that people may know more about mental illness, because everyone can be a potential candidate. Thank you so much for watching. See you in our next video.